Christine. I'm from Occupational Therapy. And today's session, I will be talking about wheelchair measurements and basic positioning devices. What I have here today is a basic manual wheelchair. In order to measure wheelchair or measure the proper fitting wheelchair, there are 5 categories that we look at. We look at seat width, the seat depth, the seat height, back of the height or back height, and arm height. So now I'll measure the different wheelchair measurements that we just talked about. First, we'll measure the seat width. So what you do is you measure the widest point across the hips or the thighs. For him, the widest part would be around the thighs area right here. So all the measurements are in inches, by the way. Okay. So that's about 16 inches, and usually you add 2 extra inches just for comfort when sitting down. Okay. For the seat depth, we measure from the buttocks area to the popliteal fossa, or the back of the bent knee. Okay. So right here to here. That's about 20 inches. However, because he is a self-propelling patient, we usually subtract 1 or 2 inches from it. So it's better for him when he propels and doesn't hurt the back of his knee. And the next one we'll measure is seat height. So the knees and the ankles should be positioned at 90 degrees. Okay, right here. And we measure from the back of the bent knee all the way down to the heel area. And that's about 19 inches. Okay. And the next one, we look at the back height. How far patients should have a back height right here for. And usually we look at 3 different categories. We have to determine if a patient needs extra cushion for the head. For example, a patient who has cerebral palsy or spinal head injury. And the other one is if a patient is self-propelling or not. So that's a different one. And the other one we measure from top of the shoulder to the buttock area for general basic wheelchair. For him, he is a self-propelling patient. So what we do is we measure for the mid-back of the scapula. Right here, usually it's about 1 or 2 inches down to the scapula. So from there, okay, find the scapula. From there, you measure down to the buttocks region. And that's about 17 inches. And the next one that we'll look at is arm height. So you have patient's shoulders all neutral, and you have them bent. And what you do is you measure from the bent elbow here down to the cushion seating. And that's about 12 inches. We're going to measure a different device. Adaptive equipment is walker or cane measurements. Walker and cane measurements are usually the same. So cane and also walkers come in different sizes and shapes. So important that we need to know the measurements as well. So now I have him stand up in order to measure. Okay, have the elbow flex a little 20 to 30 degrees. And you measure from the cane or the walker from bottom to the top here to all the way to the styloid process or the wrist area. Okay. So you can see here it matches his wrist to the top of the walker right here. So this one is a good height for him. Okay. Hopefully this information is useful, and thank you for watching.